So the case here describes that this patient had a marked response, a real partial response radiographically with tumor shrinkage. This is really what I would call an exceptional response to sorafenib. In randomized studies, sorafenib has a response rate of single digit, 2 to 3%. In more modern studies, that's a little higher, but still single digit. The fact that we're seeing this response then is fairly unusual. Typically, patients have a slowing of progression, and in that setting, we are able to improve survival. Improving survival in the setting of HCC with the systemic treatments we have seems to be independent of imaging. So even if this patient had stable disease at these imaging time points, we would still say that we would continue treatment, that the patient is likely benefiting. The fact that the patient has a significant response is intriguing and good for them. Lenvatinib is a small molecule tyrosine kinase inhibitor that is currently approved in thyroid cancer and kidney cancer. And it's been shown to have activity in liver cancer. There was a large study, the REFLECT study, that was a non-inferiority study in patients with advanced, well-compensated liver cancer comparing sorafenib to lenvatinib. The study was a positive study. It's actually the first positive phase 3 study in frontline liver cancer in over a decade. And with that being said, lenvatinib was shown to be non-inferior and not superior. However, if we look at some secondary endpoints such as response rate, progression-free survival, time to progression, lenvatinib did have superiority over sorafenib. The tolerability of lenvatinib is fairly typical for its class. Unlike sorafenib, it has a little higher incidence of hypertension, but has less incidence of hand-foot skin reaction. So this patient, in my opinion, would be a candidate for lenvatinib. They are well compensated. They have a tumor that is Barcelona stage C. And we've seen in randomized studies that in a patient like this, it is another good option other than sorafenib.